We will continue with our next keynote speaker, Dr. Fabrizio Fea. So he's here. He's a neurologist, psychiatrist, and forensic doctor. He has held leadership roles within the European Association of Service Providers for Persons with Disabilities, including Vice President and Chair of the Employment Forum, a Fellow of ICIT and President of Best Buddies Italia. He has extensive experience in disability policy, employment, health, and inclusion at both national and international levels. For over 35 years, he has lectured at conferences worldwide on employment, education, health, and the use of international classification of functional. Thank you for your presentation, please.
What I would like to tell you is something about the experience that I had in my center. I have a rehabilitation center in Rome. And we have persons with intellectual and developmental disabilities in a daily environment. They come in the morning at 8:30. They spend the day together with us, and then at 3:30 they go back home, so they live at home. The reason why we are here now is because when it happened to talk about cancer, to make this research together with Susan and the other colleagues, I think that one of the thing they wanted to have is something very practical. So what I would like to tell you, it's how we face cancer in a center with persons with intellectual and developmental disabilities. So we prepared together this presentation. It's written here by them, so I will read particularly what we did together. One sentence, one slide, that's in a very simple way. But it gives the idea of persons with intellectual and developmental disabilities face a problem like cancer. Some of them have this experience at home, but they didn't speak at home about it. Dad passed away because it was time to do it. But a lot of families don't know how to explain and how to face such problem together with the son or the daughter, that they say they already have a disability. Why should I put on his shoulder, a problem like cancer? Yes and no. Of course, when I spoke about this problem in my center, before I spoke with the parents of them to be sure that I was not hitting no one. So I sent a letter to the families, and the families replied, yes, you can. And I prepared a very small questionnaire. I will show you some results of it. And we went into the discussion of cancer. First with the families, only the families, now also with the clients, some clients. I have 80 clients, as I said, spending the daytime from Monday to Friday with several activities. It's a large center in Rome. Apart from many activities, we have also horses, rabbits, dogs, and so on. So very movement daily activities for them. So I would like now to move to the slides so I can show you. The slides some of them were already organized. They accepted. so we could discuss about it. They know that I'm here talking about them, about this problem. I think that we need academic research, of course, and academic research needs practical daytime, so we can work together. Otherwise, it will stay something on the books and nothing more than that. And also the way we work, the way we explain to our researchers how we work, it makes easier to the researchers to make their own research also. Sorry for my voice, but the air conditioning killed me. So this is. Yeah. I will read a bit. This was the first slide. Well, the really first slide, when they knew that I was coming here for a conference, was they organized me also how to say, ladies and gentlemen, then blah, 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 I'm here. So I will skip it. Our work starts from a simple yet crucial observation. People with intellectual disabilities continue to face significant barriers in accessing cancer prevention services. In daily clinical practice, we observe communication difficulties, lower participation in screening programs, limited access to healthcare services, and a persistent underrepresentation in scientific research. These challenges create health inequalities that Europe cannot ignore anymore. Cancer prevention remains one of the most effective tools for reducing mortality. Organized screening programs, early diagnosis, and healthy lifestyle promotion save lives and reduce healthcare costs. However, prevention is only effective when it is truly accessible for all. Within the CUPID project, we developed a pilot experience at the Association Scuola Viva, that's my center, in Rome. Through a questionnaire administered to families, we explored awareness and knowledge of cancer prevention issues. I will say something a bit later, a couple of slides I prepared to show you. The results were encouraging. Most families reported awareness of cancer prevention activities and national screening programs for breast, cervical, and colorectal cancer. Many families also reported direct experience with cancer and demonstrated awareness of healthy diets, weight management, and anti-smoking strategies. This was, as I said, the first part only with the families and not with the clients. Nevertheless, the data highlight persistent barriers requiring targeted intervention. Information alone does not automatically translate into effective participation. Another major issue concerns epidemiological data. At present, we do not know exactly how many people with disabilities are affected by cancer in Italy. I presume that the other countries shouldn't be so different. This lack of information in any case limits our capacity to develop effective health policies. Our experience also confirms the importance of the social model of disability. Disability is not determined solely by individual conditions, but also by accessibility of services and the responsiveness of society. Now, I'm going to jump. People with intellectual disabilities must benefit from the same rights to prevention, early diagnosis, and treatment enjoyed by all European citizens. And I want to go to, sorry if I have to. Yeah, this is part of the study that we had with the families I told you before. 80 families, not all gave a reply, almost 50. And we wanted to know what they are thinking about it. So, are you aware of cancer prevention activities? In any case, not all replied yes. Some don't know anything about it. Let's say our families are very simple families. They don't pay anything. We are paid by the local, regional government. So some of them really, they are happy that their son or daughter are with us, making a lot of nice activities. But their poverty, it's a level quite low about it. So some of them do not know anything about cancer. Do you know of national or regional cervical, breast, bowel cancer screening services? Again, 39 said yes, but 9 didn't know anything about it. Have you ever faced the issue of cancer in your family? 30 yes, 16 no. Do you know of health plans such as maintaining a healthy weight, healthy diets, against smoking and so on? A majority, yes, but still people who doesn't know anything. About the comments were we don't know anything, so please tell us more and do something in your center so that also our daughter and son may know something more in the way we can move under this point of view. So we decided, thanking the opportunity to be in the group of CUPID, to move a bit more ahead at my center as well. What was the most thing that we found? To adapt materials, to improve communication, raise awareness, and strengthen families' partnership. Accessible communication, flexibility, trust building, ethics, and participation. These are the main findings that we pointed out, and we are working on this in this period in my center. Systematic data collection, accessible screening programs, healthcare professional screening, support for European research, and active family involvement. We divided part of our clients in very little groups, and we are carrying on this, and we hope to have some good results soon about it. The main result has been to involve families and clients of what we are speaking about, that it exists, is there. We have to take care of it under several points of view. So I think that this is the win-win situation that we reached being together in CUPID. Which are the messages that from here we are going to take home? Research starts with questions from practice. Better evidence leads to better outcomes. And no citizen should be left behind. But this is, for all, the main sentence coming from our groups. So thank you very much. That's my presentation. If you want to take my address or whatever, if you want to write to us and make common discussion about this topic, I will be very pleased. Thank you again.
Thank you. So we are happy to take some questions if you have. So what do you think about the key factors? Are they really applicable because you work with the family, you are working with the families? Mm-hmm. So we all know what we should do actually, that outcomes are amazing and make sense. But what do you think in the practical way? Is it possible really to, because you have the lists that you keep on findings. Is it, how practical are they?
Well, you have...
Yes, we know we must do them.
Exactly.
Yeah.
So you just involve the persons, mm-hmm. the families, convincing them that it's something we need for everybody, for the society. So you have to give a little bit more address to them, a bit more facilities. Otherwise they say, well, this is too difficult, we don't know how to face it. So we help the families also. My operators are very close to the families who are willing to carry on the research. So this is what we are doing.
Okay. Always support and support, then. That's the key.
Yes, at the beginning, support is the key word for everything, in any case.
Okay. Thank you. Thank you very much.
You're welcome.
So now it's the break time. And,
okay.
Thank you.
Thank you again. Microphones are not, this one works. Okay. So for the accessible summary of the session, I would like to invite Valerie to the stage. Okay, thank you. You may use this one.
Thank you.
Thank you. Or would you like to use? Oh, it's okay. Mm-hmm.
Sarah's summary. People with an intellectual disability face more challenges with cancer prevention. It is important to make cancer prevention fair for everyone. Europe can make cancer prevention fairer. There is work being done for making cancer prevention fairer. Raymond's summary. Raymond's sickness was not found when it should have been. He found it hard to tell people about his pain. Knowing he had cancer early would have helped him. Better communications and healthcare staff training could help people like Raymond. Fabrizio's summary. Fabrizio works with people with intellectual disability and their families. He asked them about their cancer prevention. Work like this can help us find ways to improve cancer prevention and screening for everyone. Daniela's summary. It is good to try to stay healthy. There are things that can help to prevent cancer. Daniela did not like needles. Good communications helped her decide to get an injection that helps prevent cancer. Thank you.
Okay. Thank you, Valerie, for this excessive summary. And I would like to introduce Valerie to you. She is a student on Certificate in Personal Development Program in SETU. Her university experience has helped her grow in confidence, independence, and self-advocacy. She has developed the skills to present to her peers, advocate for inclusive education, and embrace new challenges. Valerie works as a peer facilitator in CETU, supporting first-year students and ensuring their voices are heard. She has advocated previously at a European Access Network conference and participated in the Erasmus Blended program in Salzburg. Inspired by her growth, she has recently applied for independent living, and thank you for your contribution.